Hi, I'm John Martin. I'm an OBGYN from Las Vegas, Nevada, who's been in practice for over 25 years. Today, I would like to present a video on miscarriage terminology. Doctor. I did an earlier video on miscarriages, so hopefully you've watched that, and this is kind of a follow-up of that. I think the first thing that I want to get across to women with the terminology is a very deceptive thing. We as medical professionals call a pregnancy loss an abortion. What the public calls an abortion, we as physicians call elective terminations of pregnancy. So certainly that needs some clarification. The reason I say this is because women will see coding on bills, or they'll receive their explanation of benefits and see on their bills, and they'll see the term abortion. And that's kind of horrifying to go through, as they've already just lost a baby and they could not control that loss. So I want to be clear. We use the term abortion as a term for pregnancy loss. The other thing is there's some disagreement of terminology, and that is that miscarriage to me is what occurs in the first trimester. And I just divide the pregnancy into thirds. The first 13 weeks is the first trimester, 13 to 26 weeks is the second trimester, 26 to 40 weeks is the third trimester. There are second trimester losses, and there's even stillborns. Those are much further along in the pregnancy and actually far less common. Miscarriages greatly occur in the first trimester, in those first 13 weeks. I believe statistically what you read is 70 to 80% of pregnancy losses occur at that time. And when you're over 13 weeks, there's a less than 5% chance of losing a baby past that point. So kind of getting into the terminology, the first term I would like to get across is something called a missed abortion. And a missed abortion is when you'll go in to see the physician, you might not have any bleeding or cramping, they'll do an ultrasound and they will find a pregnancy and there will be no heartbeat. And you wouldn't have had any warning of this. This can be at your first visit, and that is totally devastating. I know that. And that is when the pregnancy has not grown past a certain point. Make sure your physician convinces you that this is what is true. All right. So if you want to be seen a week later and do another ultrasound, then they should allow you to do that. So a threatened abortion is when a woman will have vaginal bleeding and maybe accompanying cramping, and they will still on ultrasound see a heartbeat of the baby. So as long as there's a heartbeat, this is not a miscarriage or an abortion or a pregnancy loss. This is a threatened abortion. It is possible, about 30% of women, depending upon what you read, go on to have normal pregnancies while experiencing bleeding in the first trimester. So by no means does it mean you're going to lose your baby, but it certainly is of concern, and you should be seen by your physician to be evaluated when you have bleeding. I personally have seen women have very heavy episodes of bleeding and go on to have successful pregnancies. The next category is what I call an inevitable, not what I call, what is called an inevitable abortion, meaning that there is no heartbeat, there is cramping, there is bleeding, and it is going to inevitably happen. And then you have to have your discussion with your physician as to how best to treat that. I actually will do another video on treatment of miscarriage, but that I always say is a discussion between you and your physician to make the decision that is best for you. The next category is an incomplete abortion, and that is where you've passed some of the tissue out, but not all of the tissue completely. That is a really important thing to have a discussion with your physician. How much bleeding is too much bleeding? Everybody will kind of give you their own variation. But what happens with an incomplete abortion is you'll pass some of the tissue out, but not all of it completely. So you'll still be bleeding heavily and you'll be cramping heavily, and it doesn't seem to let up. For me, I give my patients the parameter of if you soak more than 2 pads in an hour for longer than 2 to 3 hours, then you need to go to the hospital to be evaluated, or at least call the office. Of course, if before then you don't feel good, you feel lightheaded, you feel your heart racing, then you go in sooner. What happens in the next category, which is a spontaneous abortion, and this is kind of how you differentiate between the incomplete abortion and the spontaneous abortion. With a spontaneous abortion, the bleeding will get very intense, the cramping will get very intense, and you'll pass that tissue out. And once you pass that tissue out, the bleeding will slow down. It will not go away, but it will slow down significantly, and then the cramping should get much better. I will tell you this, it's very scary to undergo a spontaneous miscarriage. You bleed very heavily, much heavier than a normal period, unless you have the periods from hell. But it really is a lot more than a period, and it's very scary when it occurs. And that'll be a discussion you have with your physician on what to tolerate, or even if you want to go through that. And that I'll talk about in the management of miscarriages. So to review, you have a missed abortion. The next is a threatened abortion, the inevitable abortion. And then the last is a spontaneous abortion, and that's what everybody calls a miscarriage, where you cramp, you bleed intensely, you pass that tissue out, and then the bleeding slows down and the pain gets better and you've passed all that tissue out. Now, you should verify a miscarriage with your physician. Some will do it by ultrasound, some will follow your blood pregnancy hormone levels until they're zero, some will do both. Whatever you discuss with your doctor, make sure you have confidence that your body has passed all the tissue out. Your friends and family may tell you you need to be cleaned out. That's kind of the quote they give you, that you'll require a D&C. It's not true. Your body can expel all that tissue out. The key is, though, that you need to be followed to make sure all the tissue has passed out. And that's the discussion you have with your physician. I hope this video was helpful. I am sorry if you've gone through miscarriages. They're a terrible thing. If you find these videos helpful, please follow me on my Instagram or my Facebook and like them and share them, because I'm really hoping to get as much information out there as I can. Be safe, be kind, and be well. Thank you very much.
Doctor, doctor, you gotta help me